Doing, sir.
So, myself, Dr. Saurav, on behalf of this team of DBMCI, and today we have a very special guest with us, Dr. Sarath Shankar, who have just come up with an amazing rank in this FG exam, and he has got 181 marks, right, Dr. Shankar?
Yeah,
Dr.
yes, sir.
Sarath, 181 marks. So, very big congrats for the whole team of DBMCI to you.
Yeah, thank you, sir. Thank you very much.
So you have just made us proud, doctor. So how are you feeling right now? I know, like you will say, sir, I'm out of the this word. The feeling is
Yeah,
totally amazing.
actually, I expected that actually 2 days before I just checked some other academies recall question, but when I checked that, I didn't thought that I would make this exam because and when the result came, actually I was totally surprised because then I understood that just this I mean the recall questions of some answers were completely wrong. So it is just about 30 plus questions were wrong in some. So I was very surprised to see my score and my rank.
Okay. So, doctor, we are here to share your journey of the success, right? So, if I if you want to know like how you have started preparation for your exam and what are the all the challenges you have faced, so let's start these things one by one. Okay. So I think there is some breaking in the
Yeah,
connections.
yeah,
Doctor, are you able to listen me?
yeah, sir, I can answer.
Okay. So we just want to know about your journey, like when you have started preparing for the exam.
Sir, actually, during my course of MBBS, I used to watch the medicine and of gynecology videos from various courses, and I actually created a base of such major subjects from there. Later on, I started to prepare from. I actually graduated on June, and I started to prepare from August first second week. So I used to watch the rapid revision videos of most of the sources and used to take GT. I took one GT before starting my studying, and actually that was at that time I only just merely scored not I didn't pass the 150. I got only 110 or 120 something. So I understood my level. So where should I start from? And all I understood from so I used to I started from the major subjects first, and I just wrapped up them, and later on I used this minor subjects. Then I used rapid revision videos.
Okay, so doctor, like if a new student has planning to prepare for this exam and he is just going to start the preparation, right? So you would suggest like the person
Yeah,
should start with the final year subjects according to you. Like it's always better to go with the major subject
yeah,
first. Yeah,
yeah, sir. Actually, FMG exam is like it's just not about any rank. It's only just mere passing exam.
yeah.
So we have to look for which subjects that we get maximum score. So according to the schedule put upon by NMC, it's the major like PSM for every foreign medical graduate. PSM is actually a total
Yeah,
new subject
definitely.
because it's overall a new subject. So I will prescribe everyone to study PSM at hard because it's actually a new subject and like medicine, surgery, and other subjects were actually taught up to some level in most of the colleges. So you have to create a strong base in our major subjects, and mostly for anatomy and all. If you have no any if you don't have a strong base in that, you can watch major videos. But I don't ask them to watch major videos because in a short time span, I don't think so. Everyone can complete all the major videos. So I think rapid revision of most of the sources will be helpful, and always try to do at least 50 to 100 questions every day. That would be much helpful
Okay, so
because
what
only
what I have got to know from you that a student should read the major subjects first of all, or the subjects which have
yeah,
more weightage in the exam as per the NMC schedule, right?
yeah,
Number two, the
yes
student
sir.
should
But
also
actually,
do around 50 to 100 MCQs on daily basis to clear this exam,
yes
first of
sir.
all, right? Okay,
Yes, sir.
my next question is like which subjects do you recommend to your juniors? Like the subjects which have more weightage, because there are many students who have just started preparing, so even they don't know like which subjects are important, which are not. So like one subject you mentioned is PSM, but apart from PSM, which other subjects do you recommend to read?
Sir, OBG is much important. Surgery is also much important. And
Okay.
like, but for that subject, you should get OBG, medicine, PSM, and surgery. You should get because those are the main subjects that you will get about 20 plus questions.
Okay,
And
okay.
you have to create a strong base in those subjects.
Okay, so these subjects obviously require more attention and or also, and
Yes,
we can
sir.
say they also require more time, right? Plus,
Yes, sir. Yes,
you're
sir.
also suggesting that apart from doing these theory things, the student must do some 50 to 100 MCQs on daily basis, right?
Sir, actually, it should be our daily like we take our lunch, dinner. Like we have to do at least you have to keep at least a 1.5 hours for only doing questions. Even if you miss one day, if during this journey you will have some family events coming, maybe some
Mhm.
important events coming. Even if that day, if you skip your studies, you should do at least 100 questions that day. Even it doesn't matter if get wrong or right, you have to do because it is the only way that you keep in that pace because you will
Right.
lose the pace if you do that.
One should also come to know like what kind of questions can be asked and how this
Yes, sir.
knowledge, whatever theory they are reading, how that knowledge can be asked in the exam. Like what is the
Yes,
practical
sir.
application of that knowledge? So these things student will learn if he keeps on practicing around 50 to 100 MCQ per day, right?
And they will
Okay.
also know about which topics are frequently coming because
Okay. Mhm.
just mugging up the questions won't help you in scoring.
Mhm.
You have once you do many questions, you will understand which was the topic
Mhm.
that is repeatedly asking in every year. So you just note it down and just read that particular topic thoroughly, so that there are more chances that the topic will repeat in the next exam.
And doctor, like you have just mentioned that mugging up the questions will not help. So I have come to know many students
Yes,
from
sir.
these days that the question trend is changing. So the paper pattern
Yes,
is
sir.
changing, the question trend is changing. So would you like to highlight some important points like how the question pattern is changing, what kind of questions quality they're asking? Are these paper getting bit harder or getting more simpler? Like what do you say?
Sir,
What is your opinion on
uh,
that?
Sir, actually, we can't predict tendencies mentality. Actually, they will every time the question pattern is changing. Like in the July session, once I did this mock test. July session, it was like the more apt questions were like clinical based questions, but lengthy questions. But you have many crux words to crack the question. But
Okay.
during this Jan session, it was a just direct one-liner, and they were
Okay.
asking, and options were also like similar options. It's too difficult to rule out the multiple choices. So you have to create a strong. Once you see you can. It is very difficult to find the crux word from one-liners. So for the juniors, I am saying that you have to learn every question, every point you have to learn properly because just for like Viva and all you are doing just reading things, it won't help you. You have to create multiple revisions are also very important for crucial for passing the exam.
So like what we can say, like the NMC people cannot be relied upon. So they can put any
Yes,
type of
sir.
paper. So one should prepare for any kind of
Yes, sir.
pattern for the exam, right?
Yeah, sir, even the major subjects from this latest exam, I understood major subjects mark distribution were merely equal to the their original schedule that they have put upon. But for the minors, they haven't followed anything because even from anatomy, I think only 4 to 5, just less questions were from anatomy and all. Even they have put that there will be 15 to 17 questions.
Okay.
Only we can't rely upon their proper schedule. But for the major subjects, they are putting up the correct level of questions. But for
Okay.
minors, we can't predict what level they ask, and we cannot predict their mentality. So we have to learn both clinically and integration of many subjects like pharma medicine, physiology medicine. Like you have to integrate and you have to learn.
So these
So
integrations are important. Like the practical application
sir,
of the theory is more important. So like
yes
what
sir,
we have got from our discussion, like one should prepare in a conceptual manner. So if you read the
yes sir,
things in conceptual manner, then only you can reproduce in the exam. So whether
Yes,
the
sir.
exam is going to be asked from clinical basis or it's a one-liner. If you read thoroughly, if you read in a conceptual manner, one can crack any of the exam, right? So and one can
Yes, sir.
clear any of the pattern, right?
Yeah, when you have to be consistent for the exam, you will
Right.
get distractions. You will
Mhm.
get because it's a 6 month journey. You have to be focused upon, and you have to stay away from maximum distractions because there are many things going around you. You know this.
Yeah,
It's
definitely.
actually for FMGs. Once you finish the exam in June, you have merely just 1 month, and you have to come to your homeland, and you have to. If you have you have a strong determination, then you can surely pass this exam.
So, doctor, like as you mentioned, like we have to be very consistent during our preparation. Like
Yes,
we
sir.
know that it's a life. Life is full of up and downs. So you must have felt some these down phases while preparing for this exam. So,
Surely,
like
sir, surely.
whenever, sorry. So whenever you
Yeah,
have this down phase, yeah, whenever we have this down phase going on during the preparation, so how you kept yourself motivated? Because everybody has this down phase in between the preparations. So how you used to keep
uh,
yourself activated?
sir, actually, for the first 2 months of my preparation phase, I had much better speed of finishing my subjects and doing questions. But later on, I got exhausted very fast. So, by during the October last and during the November first week, I was too slow in my subject. Even I could barely complete only two videos
Yeah,
like that.
exactly.
I couldn't even watch videos sometimes.
Yeah,
So I thought so because if you just put your goal in you full, you put your heart into what you are doing. Just practice, just study for just 3 months. You could crack it, and or otherwise, if you are losing the pace, because I have completed the first 2 months of August, September, and October in a fast manner, and if I am going to quit now, then I have to be sitting for another 6 months for clearing it. So
right.
you have to be, yeah. Then just think about your parents who have invested lots of money in you for studying, sending you abroad, and also think about the stress and everything you have taken during the whole 6 years, 6 years in another country, living from your friends, family, everything. So just think about that. How much you have uh, paid there? You have to just determine yourself, and you
Right,
just
right.
say yeah, just keep watching. If you are just feeling demotivated, just watch. Just go to YouTube, watch some motivation videos. I surely know most of them will get motivated for a few minutes. Then they will go. Then they will just keep it okay. Let's start
Definitely.
tomorrow. Then
So,
procrastination will not help.
so for your surprise, like I have spoken to so many students after this exam who have cleared the exam, and I have put forward the same question to them, like how they kept their self motivated, and the same answer they have given. They just
Yes,
think
sir.
about their parents. They thought about their parents. They thought about their family. Like if they clear the exam, how happy they would be. And also they have
Yeah,
thought like
yeah,
in case they will not be able to clear it, so they have to sit for another 6 months. So that feeling, that
sir.
emotional feeling regarding the family and the parents, this kept them motivated for their exam. Very good,
Yes, sir.
doctor. And doctor, like one more question, like at the time of exam, like when you are just approaching the exam, so 20, 30 days are left. So this was the best, this was the time when most of the students got into the panic. Like they couldn't handle the pressure and they go into the panic, and that's where they get deviated from their preparation, and also they will not be able to do good in their exam. So what's your recommendation, and how did you cope up the stress at the time of exam? So last 15, 20 days, can you please share your experiences, like what kind of feeling you were having and how you cope up with that?
Sir, during the last 20 days, actually, I also got that same feeling of tension, and I
Yeah,
was also afraid how to approach the paper. So I had many good seniors. Whenever I get stressed, I will call them and I will ask them. Then they will motivate me. It's just only a matter of 20 days. Just do whatever you have done. Never learn nothing new. Just do whatever you have done. Just read the points. Don't start anything, nothing new. And just think that if you have come far this whole 6 months of journey, then you can just wait. Just put in all your effort for just 20 days. You can surely pass.
yeah,
It's a common man thing that everyone will get stressed during the last days of exam, but stress will not help you in anything. But stress
right.
will merely help you just to keep motivated. But over stress, you will get it will be very problem.
So according to Dr. Sarath, we should keep some good people around us, which will be very helpful at the time of the stress. Because whenever you
Yeah,
stress,
yeah.
you call them, you will also get some positivity out of them, right? So
Sir, actually, our DBMC faculty, ma'am, Sakshi Arora, ma'am.
okay.
Yeah, if you have any stress, actually, one of my best teachers I have seen so far was Dr. Sakshi, ma'am. So if you are feeling low, if you text her in Instagram, also she will motivate us when you are
Okay.
feeling distressed. And she used to conduct the live sessions in Instagram also. Whenever you are feeling demotivated, like so there are so many teachers, wonderful teachers for many from many coaching centers. Actually, uh, actually they are
So
a good
that
blessing
you need
for
not to worry. So
FMGs and
DBMC team is always there to help you out. So like not
yes,
not
sir. Yes, sir.
not for this FMG. Like in future, you like if you're preparing for any exam or you have any kind of professional problem, personal problem, so we are always there to help you out.
Thank you, sir. Thank you.
Right. So, doctor, one thing more, like I have spoken to many students, and everybody has given their key to success, like the key for their preparation. So, like, what do you say? Like, when you are preparing for the exam, you have just said that you should stress upon the major subjects first of all. Second, like, how many times do we need to complete the syllabus? Like, if I talk about you, how many times you were able to complete the syllabus generally? Because students say like
Sir,
they we
actually,
have to complete 4 times, 5 times, but practically sometimes it's not possible. So, like, how
sir,
many times you
actually,
were able to
uh,
complete?
so you have to know your potential first. So for some people, just two readings will be enough for them because they can easily grasp things, easily grasp the things. But for me, I'm a slow learner, so I actually used to study one subject. If I'm taking for surgery, surgery, if I
Mhm.
kept for 12, for 14 days, I used to start surgery. Then on the 15th and 16th day, or just next 3 days, I will just reverse, just fastly reverse what all I read like that. And at the last month of the equation, from December first week till Jan first week, I just only completed maximum of 1.5 revision. And for but the major subjects I all took the strong. And for minors, I usually used to do the questions, so I could understand what were the pattern. I didn't rely upon full complete revision, but I only completed one maximum, approximately two revisions.
Two revisions, okay. So according to Dr.
And
Sarath,
sir, but I don't recommend everyone to do two revisions. They have to know their potential. Some people can just with one read can grasp full. So you have to know the potential, and
knowing one's potential is more important because if you know yourself, like no one is better judge than you yourself about your body,
yeah,
right?
yeah, yes,
So
sir,
it's
yes, sir.
better like you assess yourself first, and accordingly, maybe you can go for two preparation also.
Fine.
So even the
Yes, sir.
two revisions, the quality revisions are, I mean, more fruitful than doing the 3 or 4 revisions, which are of the less quality, right?
Yes, sir, yes, sir.
And how much role this grand test and subject-wise tests when you complete the syllabus, you give the grand test. So how much role this grand test play in for your preparations?
Sir, actually,
How frequently you used to give the grand test?
sir, during the first 2 months of operation, I used to give one grand test per month. Then starting from November, December, in that 2 months, I did at least three. No, within every 2 weeks, I would do two grand tests. And
Okay.
actually, it was pretty good that I was slowly progressing. But there were some tests where, like one DBMCI test I took. At that time, the questions were much trickier, but I understood that the questions level will be like that. Yeah, it was also I about scored 152, and at that time I have completed about 80 percentage of my whole syllabus.
So like if I say like you have got 181 marks this time in your exam, right? So
Yes,
the marks you were getting in our grand test, like you just mentioned that you have attended DBMCI grand test also, as well as you have given the grand test of other platform also. So
yes, sir.
the marks you were getting in our DBMCI test. So are these marks the same which you are getting in which you have got in your exam also? The same marks you were getting in the GTs, or you were getting lesser than
Yeah,
that, and now in the exam you have got more.
no, actually, in the grand test, I was scoring more than 150 once I completed my about 80% of syllabus.
Okay. So you were getting about 150, 160 marks, right? More than 150 you were getting,
150,
but it
yeah,
was
yeah, yeah, yes, sir.
approximately 150. But in exam, you have got 180 marks, right?
Yes, sir. Yes, sir.
So you have got more
But
in marks.
actually,
Yeah.
yes, sir. but or just actually you should not much rely upon the grand tests, because grand tests are just to check whether to check on whatever subject you are weak, what you have to more focus on. So
Mhm.
I don't ask the juniors to. I think it's not good to do grand test during the last month of preparation, like the last 20 days. It's not good to do, because sometimes you may get higher marks, sometimes you may get low marks. So once you get the high marks, you will get overconfident, and if you get low mark,
Okay.
you get depressed. So that can severely affect your original score.
So if not grand test, then how we can assess our preparation? Like when we are preparing for the exam, how will us come to know that we are going on the right direction? You just mentioned
Sir,
these GPs
actually,
are not the good indicator. Then what's the indicator?
yeah, yeah, GTs are good indicators, but they are not. You cannot completely rely upon the GTs, because
Mhm.
uh, NMC's schedule is not what we think, because GTs are just based on the what the students say after the exams, like that model question usually they put. But we can questions. So according to my opinion, I could, because the most of the grants that I have did was usually clinical based questions. But when I came to the real examination scenario, it was just one
This
liners.
time it
So
was one
that
line.
difference will be there.
Yeah, yeah, yeah. Okay, okay. So it was a nice talking to you, Dr. Sarath.
Yes,
So
sir.
next, the last question. What's your next plan now? Now the
Sir,
one
actually,
milestone is achieved. So what's the next step to
yes,
do?
sir. So actually, I'm planning after applying for internship. I'm actually planning for NEET PG only.
Okay, need PG only. So okay, well, that's really good. So you're native from which place? Like you're applying this internship in which place?
Kerala.
Kerala, you
Kerala,
are
sir.
saying? Kerala. Okay, so
Yeah.
you're applying it. Okay, you're applying this internship in Kerala only, right?
Yes, sir.
Okay, so or as well as we are also planning to start your NEET PG exam, NEET PG
Yes,
preparations.
sir. Yes, sir.
Okay,
During
that's
the
really good,
internship, I
Dr.
plan.
Sarath. So my suggestion is like your momentum is already been there. So don't lose this momentum. 80% things you
Yes,
have
sir.
already
Thank you, sir.
cleared. So hardly left with the 20% things. So now this time don't lose this hope and clear this NEET PG also in first attempt. And Dr.
Sure, sir.
Sarath, in
Sure, sir.
case
Thank
you
you, sir.
have any problem, so we whole team of DBMCI is there for you. So any problem
Sure,
regarding
thank you.
anything, just come to us in any aspect regarding NEET PG preparation. We're happy to help you out in that.
Thank you,
Right?
sir. Thank you very
All
much.
the best, Dr. Sarath, for your
Thank you. Nice meeting,
this
sir.
achievement, and thanks for your valuable time for us as well as for your juniors. Take care of
Thank you
yourself.
very much, sir.
Yeah,
Thank you,
thank you.
sir.
Thank you.